1982, started this business. You know, there was Lauro S Halstead, Jacquelin Perry, and what were we told by everybody? Well, there aren't very many polio survivors, and they're all in their 90s, and they're going to die soon anyway. And from 1982 to 2008, you get the same damn story. It doesn't. The facts don't matter. You know, the fact that there are 20 million polio survivors in the world, and we're making more every day, doesn't matter. The fact that those 20 million polio survivors are going to get PPS, especially in third world countries, that doesn't matter. The fact that, you know, there are 2 million in the US and Canada, and how many in Australia?
70,000.
70 plus thousand that we're not sure about in Australia. Doesn't matter. All that matters is nobody remembers what polio was, and they don't really care anyway. And the poor polio survivors now are too pooped to even do support groups. There used to be 300 support groups in the US. In New Jersey, there are 8 million people, 50,000 with polio. At the height, there were 11 support groups. Now there's 2. Polio has returned to America. Polio has returned to Australia. You know, now is the time to do something about it. And the president of Rotary, you know, there's what's called a fellowship, which is sort of an organization of Rotarians that is allowed to use Rotary's name for PPS. And I think it started something like 5 years ago, give or take. And it really didn't go very far. You know why? Because all the Rotarians in the fellowship had polio and have PPS. It still boggles my mind that this is the only condition where the people who have to run the support groups for the condition have the condition. But then again, God and I have a lot to talk to when she and I meet, and that's one of the issues. But if maybe that's something that we can do. There's a new president of Rotary coming in who's from Korea, I think. And when he comes in June or before Wolf Wilkerson leaves, maybe we can put together a plan to focus on, you know, 08, 09 and get the clubs to distribute the information. Well, in terms of the NIPID campaign, which hopefully will focus both on vaccination and on post-polio sequelae, Rotary has agreed to distribute information to their clubs. Now in North America, and then probably later in the year and next year in Canada, in South America, and, you know, why not in Australia? You know, it doesn't take a heck of a lot to send a flyer of some kind and say, you know, give it to the club and say, we would like you to take this to your pharmacy, your doctor, you know, your local hospital. There are something like 350,000 Rotarians in, I think, North America. Well, that's a lot of folks with a lot of posters. If we could get 350,000, you know, posters out, that'd do a lot of good.
20 years ago, presented with my first post-polio patient, I was completely clueless. It was not something that was taught in medical school. They didn't even teach about acute polio because it was felt to be a disease of the past rapidly on its way out. And it really took the actions of our local support groups to educate me. And I feel very fortunate that my program was targeted to develop a post-polio clinic. Otherwise, I would still probably be in the dark. In the community, you know, level of knowledge amongst neurologists, amongst general internists, orthopedists, very, very low. I think the group that knew most about post-polio was the physiatry group, the rehabilitation medicine specialists. And they still are the main resource in the community if somebody's lucky enough to find one. And you know, isn't being seen by a neurologist who is knowledgeable or an orthopedist who is knowledgeable. The first, you know, 10, 15 years that I spent working in post-polio was really developing the clinical networking that I needed to treat the patients and to educate the patients, you know, involving physical therapy, working on ways to get the message across to the patients and to reinforce what they needed to do. It was really only at the Warm Springs meeting in 2000 where March of Dimes sponsored a meeting of many of the people that you're going to be speaking with, and I was fortunate to be there, talking about symptomatic medication, that it was recognized that there was a need to educate the greater community of healthcare professionals, not just physicians, nurses, physical therapists, occupational therapists, people who dealt with polio survivors with their multiple, medical needs, to recognize what was going on and to make proper recommendations. So, an educational plan was developed. It was sponsored by the March of Dimes. A couple of very nice brochures were put out, one aimed at healthcare professionals and one aimed at the lay community, explaining what post-polio was and the proper approach to it, and how to evaluate it and treat it in the physician's brochure. In California, the medical board picked up on this information and published it in their semi-annual newsletter. So every physician in California got to see that, because they all get the newsletter. What I've been doing over the last 8 years or so is kind of increasing my teaching in the neurology clinic. My Thursday afternoon new post-polio patient clinic has residents in it. They all see the polio patients, and then we discuss them and we go over treatment planning and diagnosis of other things. Not everybody who's a polio survivor has post-polio. Some have other neurologic problems that need to be recognized. I have worked with the rehabilitation medicine residency program at our Veterans Hospital and hosted their residents in my clinic. I give an annual lecture at the VA about post-polio. I give grand rounds at one of our county facilities on post-polio, and about every 2 to 3 years I give a talk here at UCLA on post-polio. I speak once a year, once every other year at a community hospital, scattered around. I seem to be on the lecture circuit there. So I think it's important to get the word out, at lunch conferences, which are attended because they offer free food, to get the word out at more didactic sessions. I think in the neurology community, at the annual neurology meetings, and there's 2 major meetings that go on, there's very little being presented about post-polio. If you see a presentation, every other year, if you see a couple of abstracts or poster sessions that are presented that deal with post-polio, it's a lot. So I think at that level, we still haven't broken through, but certainly in education of residents and people coming up through the medical system, we've done a tremendous job just in the last few years.